Hi, everyone. This is Rena, and today we're chatting with Dr. Lee Erin Keneally about cancer, how you can beat cancer and thrive till you're older than 100. So the question today, Dr. C, as I'm going to call you, is about oxygen. Now, I've heard that cancer cells don't like oxygen a lot, and that oxygen is just a great option for treatment or therapy. What are your thoughts? Is that a myth, or is there some truth to it?
Well, actually, it's absolute scientific truth about the whole body needing oxygen. So let's talk about oxygen. Oxygen is something that we all, first and foremost requirement we all need, because oxygen, if you don't have oxygen for 4.5 minutes, you will die, correct? So what diseases exist in low oxygen? All diseases exist with low oxygen. But Dr. Otto Warburg in 1936, I believe, won the Nobel Prize, how cancer cells use an anaerobic chemistry and metabolism, and regular cells use oxygen for their vital function in biochemistry. So cancer cells are a fermentative process, anaerobic process. So if a patient has cancer, that means probably their whole body, and that's the blood test that's checked on the cancer profile, which I like to really check on every single person to see if oxygen therapy is going to be beneficial. But I will tell you that oxygen therapy for anyone is going to be beneficial. Let's say you have surgery on your feet. Well, our hyperbaric oxygen is going to help you heal very, very quickly. I know because I personally have done it. And so oxygen is what keeps us all alive. Because of pollution, we have less oxygen in the environment. Because people sit and don't, move their body, they have less oxygen to their body. As we age, our circulation changes, so we have less oxygen available for our body. If you're anemic, something you don't ever think about, if you're anemic, you have low oxygen, because what does hemoglobin do? Hemoglobin delivers oxygen and nutrients to your cells. So oxygen is absolutely essential for you to live every second of your life. Now, what do we do in the practice is we use hyperbaric. We have the conventional hyperbaric. They're open so patients can see out and make sure they see someone, because sometimes people are scared to get in a capsule and breathe in oxygen. But actually, it's not that bad. The first time you'll do it, you'll overcome your fears and realize that they can turn off the machine just like that and get you out of there.
And I'll share my experience, because when I came down to visit with you, I had a chance to do the therapy there, and it was fabulous. They had a movie on. It was absolutely not scary at all. When you stand outside looking, it looks really scary. But when you get in there and you're watching your movie, time flies.
Right, exactly.
I have to say this. A week after I'd had my therapy and come back, I was at a party and someone said, "Have you had facial work done?" I said, "No." She goes, "Your skin, it's changed. It's like you've had work done. Did you go to LA and get work done?" And I just couldn't stop laughing. And I thought it has to be the oxygen therapy.
Right. So well, that's very true, because when I was doing hyperbaric, I had surgery on my feet for a bunion. And I was doing hyperbaric like 3 days a week, and I would walk around the clinic and all the patients are like, "Oh my God, you look so different." And I said, "No, it's really hyperbaric, because oxygen, look at the oxygen facials people do."
Yes.
It's the same concept, but you're getting oxygen in every single tissue in your body from the inside. So it is very, very powerful. So I use it hyperbaric for heart disease, wounds, cancer, so many different conditions. Now, the other ways to get oxygen is infrared sauna. Infrared sauna vasodilates your blood vessels, increasing the oxygen to all the tissues. Then there's ozone. Ozone has been around all over the world for a long, long time, and you can do IV or rectal ozone. Most of the studies performed on ozone are done on rectal ozone, which is a very inexpensive way to get ozone. What does ozone do? Super oxygenates the body, detoxifies the body, and gets rid of bugs. So it's a very, very effective way.
And how do you do it? How do you do it rectally?
Rectally, the practitioner makes the ozone. We have an ozone generator in the office, and then we use a special little cannula, and it takes maybe 15 minutes, and we put rectal ozone in the rectum. And your body absorbs everything very proficiently in the rectum. So it goes all over the body. Then we do
how about the breathing of the ozone? Remember, Vegas was big into.
No, you don't want to do that. You have to be very careful. You should never breathe ozone. It can damage your cells in your lung and your nose. I would never recommend that. So that's not something you do. Now, the other thing that we're privileged to have is we have a nanobath, and a nanobath is nano bubbles of oxygen. So it's a bath you lay in. It has an oxygen generator that's very, 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 incredibly developed. And it gives you nanobubbles and oxygen. And what I did is I took people's blood under the microscope before the bath and after the bath, and their blood looks like it's been all cleansed after one bath. So it's very, very impressive. So
I'm gonna have to come back and do this.
Yeah, you didn't get to do that last time, I don't think. So anyway, so nanobath is great for every, for every condition. I use it for fibromyalgia, cancer, pain. People love it. I mean, I had a patient, I did a phone consult in Michigan, and she had come out for a week, and she goes, "Oh, I need to know how to buy one of these."
Yeah.
So anyway, everyone feels better with oxygen therapies, because think about it. Pain is low oxygen. Having a heart attack, what is that? Low oxygen. So oxygen we need. And so being around nature, you get a lot more oxygen. So I encourage people, instead of going exercising in a gym, they go in, even if they can't do it regularly, they can go on the weekends, but go, exercise in the forest, exercise at the ocean, just get outside with vital, nature, and you get oxygen. And that brings me my next thing is everyone needs to move. You do not need to be a marathon runner. You don't have to be a triathlete. You don't have to be a gym rat. You just have to really incorporate movement into your existence, and that gets oxygenation to your tissues. That's why it's so mandatory for every single thing, for stress, for cancer. I tell breast cancer patients, just incorporating exercises reduces cancer return by 50%.
Oh, wow.
So we got to exercise. So those are the best ways to get oxygen to your body.
What about IV? Is there an ozone IV where they just inject?
Yes. The way they do that is we have a special machine from Germany, and we take out your blood and we ozonate that blood, put it back in, take out fresh blood, ozonate it, put it back in. So we do that anywhere from 5 to 10, what we call passes. So you get a good percentage of your blood ozonated.
But that sounds more complex. So of all the wonderful strategies you mentioned and techniques, what would you say is the one that's the most affordable for someone that's looking at the cost side of the house?
Well, a bath doesn't cost that much. A bath is very good. Exercise first. Okay.
That's free.
That's free. And then the bath, but rectal ozone's not expensive either. It's only like $65, $75. So in the bath is too. So none of those are that expensive. Hyperbaric is $125. So it's not that expensive.
Right. Exactly. I mean, these are very affordable. And for someone who wants to prevent, someone like myself, I've had a bout of it. I'm always watchful. I exercise, I move, I dance. But I'm thinking maybe I should add some form of oxygenation to my routine. What would you recommend I do on my own? Like, is a nanobath something you can purchase and keep at home?
Yeah, I think so. I know the company was making individual units. So I think they do have an individual unit. And I think that will be something in the future very available and easy to buy.
And what about those drops? I've seen this in nature stores. They have these little liquid ozone drops. Is that real?
No, it can't. It dissipates in 20 or 30 minutes. So no.
Okay. So no oxygen in a bottle. Okay. No. Sounds good.
Yeah.
And how often would you recommend someone who's looking at preventing cancer, something like a hyperbaric, or is it once a month?
No, I don't tell people that, I just tell people you need to oxygen yourself, do it through exercise. Now, they do have home units. It's called EWAT therapy, exercise with oxygen therapy. You can buy a special bicycle and special oxygen machine and just do it at home with an exercise equipment and do that yourself. It's not cheap though. It's probably about $5,000. So that's expensive.
Wow.
Yes, very
Price of a car for some people. So
yeah, exactly. It's a lot of money.
okay, now that sounds great. That sounds awesome. Is there anything you do? Is there something that you do to oxygenate yourself on an ongoing basis? And which one do you prefer?
I usually will do for fast quickness is a rectal ozone. Lately, it has not happened because I've been too busy. Hyperbaric, I've done hundreds of hyperbaric over the years. I'm just not doing it now. And exercise, I do major strength training. So I am pushing myself really, really hard, running up hills and doing major things that really get oxygen to my tissues. And I hike outside. So those are the things that I personally do because I love getting out in nature and hiking.
Well, there you have it. Now you know what the world's leading cancer doctor does for herself. Hopefully you were making notes. And if you have any other questions, check out the Can't Beat Cancer Bootcamp, because there's going to be this and much more information in the 14 days to beating and preventing cancer. So check out the link. If you have any questions, shoot us a message and stay smiling. We'll see you on another one of these. Thank you, Dr. C.